I'm Ginger Chang. Welcome to USTC360. It's great to see you again. Our featured story today is on another remarkable group of compassionate volunteers who share the same humanitarian philosophy as Tzu Chi. Since 1985, the Remote Area Medical Volunteers Corps, or RAM, has been providing free dental, vision, and medical assistance to impoverished communities throughout the United States. One unique aspect of RAM's effectiveness in delivering immediate health care to those in need is the airplanes that they own. Tzu Chi first teamed up with RAM for their medical outreach program in 2005. Since then, this dynamic team has been assisting and transforming many lives, with the most recent free clinic being held in April of this year. Tzu Chi volunteers had the opportunity to be there and experience RAM's first medical expedition in Northern California.
Under this bridge, I have almost 4 months living right here. I fed part of my family, they led me, and I am here right now, almost a year. Living in this situation of like homeless.
Entonces se saltó una batalla en el cielo.
The economy get it down, so I am still looking for work where I can work in maybe a restaurant, dishwasher or something to make me build up my future again. Yes, I will. That's what I want. I had clamps in my stomach, and I try to take care of myself. Yeah. Penicillin, they get it from Highland Hospital for my tooth. Like me, I am not a drug addict, but you have to be careful. I ride bicycle almost every day, selling recycling, and I get some money, get it for food. Yeah, that's what I do. Basically, I'm not stealing, no begging for money. So that's the part of my life right now.
Without a job or help from his family, Ramon cannot afford any health insurance. In 2010, approximately 49.4 million people did not have health coverage. RAM, Remote Area Medical, is a volunteer-driven organization that provides free health care. The 8-day journey of RAM in Northern California included a 4-day clinic in Sacramento and a 4-day clinic in Oakland.
Today is the first day we set up. Today only have 24 hours for us to set up, so we have a lot of things to set up. These volunteers are really working hard to make sure that we can open the door for patients 5:30 tomorrow morning.
Outside of Oakland Coliseum, hundreds of people lined up to receive free health care. Volunteers began handing out entrance tickets at 3:30 a.m.
So I came all the way up here from Santa Cruz, which is about 2 hours away, so that I could receive some dental care, because I really can't afford it.
Oh wow, since about 10 p.m. Just hanging out, actually camping out in the car. We're taking turns in line.
Back at 5 o'clock. Yeah, I need to see a dentist, yeah. And glasses, yeah.
Ramon just got his ticket.
Thanks for this event, so I'm gonna get for my teeth and my eyes, and I hope I get a pair of glasses and
It took us 50 minutes and we gave out 754 numbers, and at 5:30 the first patient will walk through the door to get service.
Because of the large number of people expected to seek services, patients with tickets were allowed into the clinic, a small group at a time.
All right, who's got number one? Show us the paper. Number two.
What we're dealing with here are many thousands of people that have access to medical care but simply can't afford it.
Number 25.
Are you staying?
So the main problems being dentistry. They can't afford to go to the dentist. It's not covered by any particular state or federal programs for adults. And also, the same thing can really be said about vision.
I wanted to be involved, so I called RAM and they said that there was going to be a clinic in LA. And so I volunteered all 7 days, and I just thought it was the most amazing event I've ever been part of, and I just started helping organize it because we have such a need here with all the budget cuts, and the non-insured and underinsured has increased.
I'm a substitute teacher and work in public high schools and middle schools, and I've done so for over 25 years now. That's considered being an independent contractor, and I receive no health care whatsoever, not medical, dental, or vision, or health care of any kind.
The front teeth is have a lot of periodontal problem. So I'm just trying to clean it, and I'm trying to do some deep cleaning there if possible. And then try to help him and to educate him so hopefully he can maintain and keep the rest of the teeth. So I'm just trying to give him the best care I can. Yeah. You okay?
Yeah.
Okay. You're very welcome.
This cup is reusable. Too much garbage around the world. Okay. So we want to decrease garbage. Okay. It's very easy for you to carry.
Thank you.
You're welcome. And then just make it tight, so you won't flip.
Oh, okay.
Okay?
Thank
won't
you.
spill.
Thank you. Take care. Okay.
Hello.
Hello.
How are you doing today?
Very good.
You're healthy? You want those teeth out? Okay. We want to get everybody treated. We want to get something done on everybody and get them out of pain. Last weekend was the first time I worked with Tzu Chi volunteers. And I plan on working with them some more. I like that philosophy of taking care of people. In Ram Clinic at Tzu Chi, we show up and everything's in place. It's amazing.
This table here has the dental equipment for tooth fillings and extractions. There are specific tools for fixing the front teeth, back teeth, and the molars. Each has its own, so the dentists have to personally come over here and get the right tools to use.
I'm just getting things to do silver fillings for a patient. I usually have an assistant that does this for me. So it still takes a little bit longer, but we're finding everything we need.
What do you need, Doc?
There's no, these aren't done. Yeah, they were. Well, you know, there's many sources of dental materials, and when you work in a private office, you kind of get used to handling your own stuff. So this is similar but a little different, so I'm trying to make it work. There we go. All right, let's stay there.
You found everything you want?
I did.
Are you nervous too? No. You're not? Let me take a look. I want to see if I can save that tooth. This tooth has a big cavity that goes into the roots.
Nobody.
The cavity already going to the nerve.
Okay.
I'll clean it up and I'll put a temporary filling for you, okay?
You okay, Raymond? Good job.
Thank you, doctor.
No problem.
God bless you. Yeah, I can smile again. Before it was so painful. Smile, feel better, and my teeth feel better, yeah.
Did you know that the national average cost for an eye exam is $114 for people without insurance? And a visit to the dentist's office for general preventative care ranges from about $77 to $248. These figures may not have costly ramifications for those of us who can afford it, but for people like Ramon and all the other individuals who waited patiently in the cold for at least an hour, seeking medical help is not an option. Fortunately, RAM's Reach Across America program has been addressing the healthcare needs of the working poor and the homeless, thanks in part to their dedicated team of volunteer doctors and nurses. Having to work over 12 hours a day has never been an issue because, for them, being able to relieve the pain and suffering of every patient is what matters the most.
Volunteers arrive at 5:30 a.m. Due to the large number of patients, many of them have to work over 12 hours. Hundreds of doctors, dentists, and volunteers paid their own way to join this clinic.
I think it's worth it. It is a lot of time commitment and it's very stressful and it's a lot of hard work. Having to wake up at 3 a.m., 3:30 a.m. just to come here and volunteer and set up. Because I know that even though I don't play a big role in the treatment or the actual diagnosis of a patient, I know that I'm ensuring that they're getting the services they deserve, like their health problems not dragging them down.
It has been a lot of work, especially since I have a full-time job. Just to know that you're going to help all these people, I mean at least 800 patients a day, to know that you're going to help that many people, it makes the work all worth it.
We found very common philosophy between RAM and Tzu Chi because we all want to serve the patient directly. We want to help the needy people directly. So we share the same vision, same spirit.
We've had the pleasure of working with the Tzu Chi folks for several years now in Los Angeles on 2 occasions where we saw many thousands of patients.
A truly successful person is accepted by everyone and accept everyone.
Very true.
Very true. Thank you. Very true.
David is 4. He is getting his dental treatment.
Wow, you are so good.
He got some fillings done, and we don't have insurance, so this was a great help for us. She helped my son. She watched him all the time while I was getting treated. That's very, very great. I appreciate all your time, everybody. Everybody's supposed to go home early, but they're staying here late to help us, and that is a great help.
So what's your name? What's your name again? Do you take me picture? Yeah. Let's take a picture. Yeah. Smile.
Look. Very good. Can you give me a big high five? Way to go.
All of you volunteers that you're here today, donating your time, your effort to help us be here. Thank you.
Show the picture. Oh my gosh.
Oh, ready, go. Hallelujah, hallelujah, hallelujah. Hallelujah, hallelujah, hallelujah. Hallelujah, hallelujah, hallelujah. Hallelujah, hallelujah, hallelujah. Okay, very nice.
Those patients are waiting for outside so long time. It's cold in the morning, so we kind of give them a little bit exercise. We can cheer them up. They are happy, and we are happy as well.
From the mountains to the prairie to the ocean, wide would bless America, my
so much. We really appreciate this.
Being in this industry for so many years, I understand the need for good vision and good eye examinations. Growing up somewhat privileged with never needing anything, medical care, dental care, vision care was always provided, and I never had to do without. My grandfather was a pharmacist in the Depression when people didn't have any jobs or any money, and they would bring their sick children to the drugstore and he would give them medicine. He told people that he would provide the medication, and if they could pay sometime, that'd be good. If not, don't worry about it.
So let me get you set up in here. We'll take a look at how your prescription has changed. The top one looks a little clearer.
Oh, it's okay.
I kind of learned that in my growing years, that if we have something that someone else could use, it's our duty to share.
Outside of the Coliseum parks the Ram semi-truck. Inside is a fully functional eyeglass lab. There are 10,000 lenses with different prescriptions available. Volunteers then carefully line up the axis. This machine will trim the lens down to fit the frame in 43 seconds. They can make over 300 pairs of glasses a day.
My wife and I both manage the what's called the Reach Across America program, and we basically make sure that we have the supplies we need and that the semi-truck that we drive is upkept and has everything on it and that's needed to do these clinics throughout the U.S. It's an experience that you just can't even explain. If you've never volunteered for an event like this, you definitely got to get out and do it, because it'll change your life.
Ramon came back to pick up his free glasses.
I left yesterday.
You came yesterday?
Yes.
Okay, then they should have.
Ramon? Yes.
How are you doing?
Fine, sir.
So the bottom half is going to be for your reading, and the top half is going to be for your distance. Okay, we're going to try these on. We want to make sure that they fit on your head good. So that'll include the sides of your head and the bridge of your nose. Put those on.
Okay.
Okay, and as you look at, how's the vision for distance?
Very well, very well.
Good, okay.
God bless all these doctors and all these nurses and all this organization. Give it to us all this opportunity to have something free, especially health. Total different. I can see your pretty face, how pretty you are, girls. And, it's like I see in the new war. I see everything. I don't want to take it off. I want to stay with.
Stan Brock, the founder of RAM, was pleased to share with Tzu Chi that out of the 640 clinics that they have held in the U.S. thus far, clinic number 639 in Sacramento and clinic number 640 in Oakland were two of the best because of the friendliness shown by all the volunteers that assisted and because of the immense appreciation expressed by the patients. RAM was asked to return again to Northern California in 2012, and once again, Tzu Chi volunteers will be there to help. In our next segment, Footprints, we bring you the story of Xingong Chen, an acupuncturist who works at Tzu Chi's 3 free clinics in Los Angeles. Dr. Chen is among the doctors who volunteered at the RAM's medical outreach programs. Before he joined Tzu Chi, Dr. Chen had operated a private clinic. Today, he carries in his heart Master Cheng Yen's teaching. Although we are volunteering, in reality, the people we are helping are our teachers.
大概就是一个责任。
Of course, it's a responsibility. It's my duty.
大型的义诊的话，大概都要。
It takes time and several days of preparation for us to get ready for large-scale free clinics. Every time we spend about 12 hours. Because we need to arrive by 5 a.m. and we end by 6 in the evening. When I finish packing up, it's usually after 6 p.m. So in total, it takes over 12 hours.
6点，收一收也6点多了，差不多大概12个钟头以上。那个想的时间就是有时候。
While I'm working, I'm frequently thinking, what is the best approach to helping the patients? Each case is different, so I just go according to the situation.
就是要因地制宜的，不累是骗人的啦。
I'd be lying to you if I said I don't get tired. However, if you're going to do something, you have to do it right. So I don't do it half-heartedly. This is the way it should be. Whatever you do, you should do it this way. It's the same when we teach our patients. We tell them to exercise and we ask them to maintain the routine. It also applies to being a Buddhist and being Tzu Chi. We need to be strong-willed. This unwavering enthusiasm isn't short-lived because after you completed your job, it will be meaningless. It's not something you do for just 1 to 2 days either. Instead, it's giving 1, 2, or more years of continuous dedication,
1年2年一直做下去了，
up to the point even when you're old.
到你老都要这样做。
In addition to being a Buddhist before he joined Tzu Chi, Dr. Chen has also been a vegetarian for 12 years. When we asked him how he's able to maintain such an enthusiastic attitude, Dr. Chen simply said it's Tzu Chi's spirit. He plans to continue with what he's doing until he draws his last breath. I'm Ginger Chang. Thank you for watching USTC360, and we'll see you next week.